We are diving straight into this explainer today because we're looking at a hidden, honestly terrifying reality that's playing out inside our healthcare system every single night. Look, this isn't the stuff making front page news, but it fundamentally threatens our well-being. We're talking about America's emergency contact crisis. It's this somber, unintended consequence of modern loneliness that is kind of quietly morphed into a literal life or death medical emergency. So we're going to unpack the data, the human stories, and the structural failures that landed us here. Okay, let's really set the scene here. Picture this. It is 2:13 a.m. An elderly man has suddenly collapsed in his apartment. He's rushed to a cold, bright-lit, crowded American hospital. His blood pressure is critically unstable. The ER staff, right? They immediately reach for his phone to find a contact, but it's locked. They check his records. There's no spouse listed, no children picking up the phone, absolutely no emergency contact on file anywhere. And while doctors are fighting desperately to stabilize him, nurses are frantically digging through stacks of paperwork, just hoping for a name, a number, anything. But tragically, no one comes. There's no familiar voice to calm him down, no advocate to explain his complicated medical history. And the wildest part, this isn't some fictional TV drama. This is a devastating reality that healthcare workers witness every single day across the country.
Section 1. The 2:13 a.m. emergency. The emotional reality of modern isolation.
This heartbreaking scenario really shines a light on what actually happens when someone has zero support system. Our modern isolation has turned into a true logistical emergency. It forces us to completely rethink what it means to be alone in a crisis. Because think about it, an emergency contact isn't just some formality you scribble on a clipboard. Without one, doctors hit these enormous, potentially deadly roadblocks. They don't know the patient's medication history. Do they have dementia? What are they allergic to? What are their life support wishes? In those critical situations where minutes literally matter, not having an advocate can become a fatal barrier. Moving on to Section 2, a clinical crisis, loneliness as a lethal medical condition. We really have to zoom out and recognize that loneliness in the U.S. is not just a private emotional issue anymore. It's actually evolved into a severe, measurable clinical condition. And get this, around 1/3 of Americans over the age of 50 report experiencing significant loneliness or isolation. 1/3. To put that in perspective, we are talking about tens of millions of people. That single statistic fundamentally alters our entire public health landscape. It shifts isolation from just a personal sorrow to a massive systemic vulnerability. And the research backing this up is undeniable. It proves that emotional abandonment physically harms patients. A lack of human interaction is directly linked to a higher mortality risk, right? It leads to more hospitalizations, faster cognitive decline, heart disease, and significantly slower healing times. Basically, it turns out that having a bedside companion is just as vital to your recovery as the medicine in your IV drip. Section 3. Why we are disconnected. The socioeconomic breakdown of community. So how exactly did we get here? Well, it's kind of like a perfect storm of structural failures. First, geography. Our economy pushes families apart. Kids move states away for jobs, leaving aging parents behind. Second, falling marriage rates mean way more Americans are aging single or divorced, completely lacking that built-in household support. Third, our digital lives have largely replaced true local communities. And finally, and honestly this is probably the most alarming, our healthcare system still dangerously assumes a family member will just be there to provide unpaid caregiving. Hospitals assume someone's going to drive you home and monitor your meds. But for millions of people, that someone just doesn't exist. It leaves us in this terrifying paradox. You look at our digital footprint, and it's massive, right? Hundreds of online contacts, likes, followers. Yet in the real physical world, there might be nobody to actually pick you up from the hospital at 3 a.m. It perfectly captures how our hyper-connected digital illusions are just crashing hard into our physical reality. There is a quote that really hits the nail on the head regarding this tragic irony. The modern world optimized communication, but weakened community. We have literally spent decades building incredible, instantaneous technology for talking across the globe. But in doing that, we've totally dismantled the local human infrastructure, the neighbor, the friend down the street, that actually keeps us safe when things go terribly wrong. Section 4. The cost of dying alone. The financial and medical gridlock. Beyond the massive human tragedy here, this isolation epidemic is an economic catastrophe for an American healthcare system that's already incredibly strained. Patients without support systems are literally gridlocking hospitals. Because it isn't safe to send them home alone, they end up with much longer hospital stays and delayed discharges, which of course leads to more readmissions and a huge reliance on emergency care. We are forcing America to spend billions of dollars treating the end-stage consequences of isolation, rather than just investing in preventing it in the first place.
And hey, if you're thinking this is just an issue for the elderly, absolutely not. This affects single professionals, divorced adults, remote workers, disabled Americans, veterans, and people who relocate to major cities without local ties. Vulnerability does not care about your age or your income. Someone can appear super successful, wealthy, and popular online, but have literally nobody to call if they're in a sudden car accident. Section 5. Building a new safety net. From digital complacency to physical community. Look, a wealthy, advanced country simply shouldn't allow its citizens to die emotionally abandoned. So what's the fix? The structural solution really starts with care networks. These are community-based support systems where neighbors, volunteers, local civic groups, faith organizations, they maintain emergency contact lists and do daily wellness checks for isolated people. We've got to normalize these networks nationwide. We have to start treating severe isolation as a literal medical risk factor, screen for it exactly like we screen for smoking or obesity, and expand these vital wellness programs for folks living alone. But let's talk about you. There are steps you must take personally right now. Number 1, create a concrete emergency contact plan today. Make sure your medical info is accessible. Number 2, intentionally build real physical community. Find neighbors who will actually notice if you disappear for a few days. Number 3, help normalize community care networks in your own town. Number 4, advocate for healthcare systems to screen for social isolation. And number 5, prepare decades earlier, no matter what your current age or health status is. Do these things to transition from just assuming everything will be fine to actually having a structured physical emergency action plan.
We really have to internalize this reality. Building relationships is no longer just emotional self-care. It is emergency preparedness. This is a total paradigm shift in how we view friendship and local community. Grabbing coffee with a neighbor or joining a local group, that's not just a hobby anymore. It is an absolutely essential component of your medical survival strategy. I want to leave you with this final chilling thought, and it's a question I really want you to ask yourself right now. If you collapsed tonight, who would answer the phone? If this explainer reached you today, please take one small, tangible action. Call a friend, introduce yourself to a neighbor, update the emergency contacts in your phone. Just intentionally build your physical community. Because one day, for sure, every single one of us becomes vulnerable. Thanks for joining me on this explainer, and I truly hope this sparks the connections you need.